According to the Winona State University website, there are 8,500 students on this campus. Out of those 8,500 students, there are 265 of them that would have a birth defect. And 11 out of those 265 would have the birth defect of a cleft lip and palate. These stats are calculated by the book Cleft Lip and Palate by Raymond and Phyllis in 1975. Today, I'm going to enlighten you with my info on cleft lip and palates. My first main point will be about what is it, my second will be the causes, and my third will be the treatments. For my first main point, I am going to define birth defects, and I'll also define what cleft lip and palates mean. The book The Diseases and Disorders of Birth Defects by Jacqueline Langworth of 2010 explains that birth defects are abnormalities of structure and function of the human body. In the book Child with a Chronic Condition by Judith Vesey of 2000 explains that cleft lips are unilateral or bilateral and incomplete or incomplete. This picture shows what a unilateral incomplete looks like, which means that there is a slit but doesn't reach the nasal cavity. A complete would reach the nasal cavity, and the bilateral has two slits up towards the nasal cavity. A cleft lip is described as a primary palate and secondary palate, which either goes to the nasal cavity as well. So this one would be the primary, which doesn't reach the nasal cavity, and the secondary would be that it goes into the nasal cavity. My sister was born with a bilateral cleft lip. In my second main point today, I will be talking to you about the causes and how you can get a cleft lip or palate. From the Gale Encyclopedia of Surgery and Tests by Narens Brigham of 2009, there is no actual known cause of a cleft lip or palate. Although on the Mayo Clinic website, published the last updated in 2016, it explains that a mother or a father could pass on the gene, and some babies could inherit that, which would be more than likely to develop the cleft lip or palate. An environmental factor would also trigger this to happen. It could also be caused by drugs or alcohol. For an example, in 2003, a study found that the use of corticosteroids in the first trimester of pregnancy may be associated with cleft lip, which is from the book Diseases and Disorders of Birth Defects from 2010. Given these circumstances, my mom was never on drugs or alcohol while pregnant, which makes this more of an unusual case. Which brings me to my main point, number 3, the treatments. The treatments for cleft lip can be repaired at any age. The first surgery, however, is usually between 2 to 6 months, from the book Gale Encyclopedia of Surgery and Medical Tests. All of these treatments are available, but insurance types and physical access can be hard to obtain. The first procedure, however, closes the lip and the palate. For the Mayo Clinic 2016, to close the separation of the lip, they would make an incision to create a skin flap and fold it over and then end up stitching it up. For the cleft palate, it is basically the same process, except for they would move muscle and some tissue around to close up the gap. For this, it would create a normal appearance, structure, and function after this surgery. After surgery, some children might need speech therapy, says Donald Kunkel from her book Advice to Parents of a Cleft Palate Child, published in 1970. Children might also need extra dental management. My sister had her first surgery when she was 5 weeks old. She had the skin pulled down from her nose to heal up the gap between her nose and her mouth. She was born without her 2 upper teeth because there was never no bone to create the teeth up there in the first place. In 1st grade, she had her first set of braces, and she had those braces until she was in 4th grade. In 8th grade, she received her braces again until 10th grade. This upcoming November, she's getting surgery, which is called a 1 graft. This typical surgery takes bone from your hip and puts the bone where she has her missing teeth. This surgery heals within 3 months, and she gets screws to hold in her implants, so basically like fake teeth in a way. In the summer of 2017, she will receive plastic surgery to remove the extra skin. and within this, she will hopefully be clear from this birth defect. And I know that this info because I have spoken to her doctor, Deepak Kadamani from the North Memorial Hospital in September. Today I explain to you the birth defects, specifically cleft lip and palates, the causes, and the treatments. Now remember this fact from the book, The Diseases and Disorders of Birth Defects by Jacqueline Lankworth of 2010. There are over 5,000 different birth defects, and cleft lip and palates are in the top 3 most common. Being one of the most common, my sister has never stopped striving to overcome her birth defect.